does mess up. So I'm glad to be here tonight. My name is Stevie Crane. I am the clinical coordinator here at the Sleep Disorder Center. As you all know, the video tonight is going to be talking about obstructive sleep apnea in the bariatric process. So what I want to talk to you about tonight mainly is what everything revolves around for me, which is sleep studies, and CPAP, treatment for sleep apnea. First, I want to talk to you about what sleep apnea actually is. I'm sure that several of you have heard of it and maybe even have been tested for it already, or maybe even know someone that has it. Sleep apnea is just when your airway collapses and causes a pause in your breathing for 10 seconds or longer. It also causes your oxygen levels. Let's see here. There we go. I'm sorry about that. I put my phone on Do Not Disturb. I forgot to do that. So sleep apnea is when your airway closes off and it causes you to stop breathing in your sleep. I know this is very basic, but I always do this little diagram with my hand. So this is how your airway should be. It should be nice and open for your breathing. What happens when you have sleep apnea is either your airway closes off a little or it closes off a lot. We score them differently, we measure them differently, but that's what's happening. It's closing off. And then what happens when it closes off is that it sends a signal to your brain that you're not breathing and that you need to wake up. So you wake up and then you do it again. In about 10 seconds, your oxygen levels are dropping, and then you do it again. You wake up a little bit. Now, when I say wake up, it's not like you're like wide awake, like, hey, it's that you, it's just sending that signal to your brain. So your brain wakes up for just about 3 seconds, and then you do it again. So I know that's very basic with my hand gesture there, but that's exactly what's happening in your airway to collapse. So in order to test someone to see if they have sleep apnea, we would do a sleep study. Sleep studies are based on, we do those for sleep apnea if you have certain symptoms. Some of the main symptoms of sleep apnea are snoring, sleepiness, fatigue, being overweight, and also just feeling really tired throughout the day. So if you have those symptoms, we would do a sleep study on you. Sleep studies are done a few different ways. The main way and the most preferred way that we do a sleep study is by bringing you in here to the Sleep Disorder Center. And you would come into your own room. We would apply several wires to you to test different things, whether you're awake or you're asleep, if you move your legs, your heart rate, your oxygen levels, and of course, your breathing. So it would involve you staying all night here with us here at the Sleep Center. And when you woke up that next morning, we would be able to tell you if you have sleep apnea or not. That's called a diagnostic sleep study. The other sleep study that some of you may have heard of or have had is a CPAP titration study. It's ultimately the same type of study, except when you come, we allow you to wear the CPAP device, and then we figure out what pressure you need on that device. So that's, in a nutshell, what an in-lab sleep study is. The other option of a sleep study is a home sleep study, and you may have heard of this as well. Home sleep studies are predominantly insurance-driven. They are a cheaper option, they are an easier option, but they are not as detailed. So that's why our providers do not prefer to always order a home sleep study on a patient, just because they're not as detailed and the results are not always as accurate. However, I do home sleep studies every single day. I do about 5 to 7 a day that I put out. And we've got it to a science pretty much of how we do them. And they have been known to be pretty accurate for us. So like I said, they're insurance driven, but your provider may also order a home sleep study if the in-lab study is just not for you. You know, there are issues with patients where you just absolutely, I'm not going to stay the night somewhere else. And a home sleep study would be an option for you. So the way that we do a home sleep study is you would be scheduled to pick that up. We do those, I typically schedule them all throughout the day. When you arrive to pick it up, I would bring the equipment out to your vehicle because everything is COVID style now. So that's how I'm explaining it to you. Bring the equipment out to your vehicle. I would provide you with all of the equipment, and I would also provide you with the name of a YouTube video that you can watch, and it would show you exactly how to put the equipment on yourself. So, like I said, this is a new COVID style way that we're doing it, and it has been excellent. It's been really great. We created a video back in March, I believe, and that's just every patient watches that video. It's about 13 minutes long, and it's me in the video explaining every single step of the home sleep study so that the patient knows what they're doing. And ultimately, you take the equipment home and you wear the home sleep study that night, and then you bring it back to me the next day. We get your results with that in about a week. As far as I want to shift towards the process, and some of you have may have already been in this process, been out of it, or you're fixing to start this process. I imagine that all of you are bariatric patients. So you would all have seen your bariatric provider, and they, based on those symptoms we spoke about earlier, they're going to tell you you have to have a sleep study before we can move forward. Or for anyone in general, if you have those symptoms, or if your primary doctor, your cardiologist, anyone can see those symptoms, they would order you a sleep study. With our sleep center, you have to see one of our pulmonologists or neurologists first. 9 times out of 10, our patients go through pulmonary consultants to have the sleep study done. So we have about, I'm going to say 11 to 15 providers over there that see patients and order sleep studies. So your first step would be to see that provider. It's a consultation, so they're going to talk to you about your sleep issues, and then at that point they would schedule you for your sleep study. And also at that point they would make the decision, are we going to do a home study or are we going to do an in-lab study? They're going to schedule you for your sleep study, probably within about a week or two, and then we'll call you several times from here at the sleep center, confirm that you're still coming. You'll come in, you'll have your sleep study done. That very next morning, if you have an in-lab sleep study, you will get your results from your nurse practitioner. And then after that, you will continue follow-up care with pulmonary consultants. They will, I think they do those about, every month, and then it kind of trickles down a little bit to maybe every year that you do follow-up appointments with pulmonary consultants. And the benefit of that is that they keep up with your sleep needs. So if your bariatric provider was the one that sent you for the sleep study, or your just primary care, anyone that sent you ultimately to that pulmonary clinic, they don't have to keep up with all of that anymore. So that allows pulmonary to handle all of the sleep needs. If you do get CPAP, they can continue ordering your supplies that you need, things like that. Now I want to move forward. We're talking about the treatment for sleep apnea. So I'm sure most of you are aware of what a CPAP is, but I'll just tell you a little bit. I wish I would have got a little demo to show you all. But so if you are diagnosed with sleep apnea, the ultimate treatment, the best treatment, is going to be CPAP therapy. That's continuous positive airway pressure. A CPAP is a machine that blows out air. It also has humidity connected to it for if you want to use that. It's a tube that connects to a mask, and you wear it on your face. So I'll just show you, go back to my simplistic hands here, since I don't have a demo. There are several different kinds of CPAP masks. As far as the machine itself, there are different brands of it, but they ultimately do the same thing. They just push out the air. But the masks are all different. You've seen masks that cover just your nose. You've seen masks that cover your nose and your mouth. You've seen really scary masks that cover your whole face. Nobody actually wears that. That's crazy. Over the years, constantly, these masks have been improving. So if you was diagnosed quite a while ago, even a couple years ago, since then the masks have changed. Everyone about now is all about doing something real light underneath your nose, minimal headgear, all great working mask. So as far as the CPAP, like I said, it blows out air to keep your airway open. Remember, your airway closes off. Here comes the air to open it up. The question, though, is how much air do you actually need to keep your airway open? That is why we do the CPAP titration that I mentioned earlier. We can actually tell with a sleep study when you stop breathing, and we use a protocol that tells us when to increase the pressure on your CPAP machine. So some of you may be thinking, well, I don't use a CPAP, I use a BiPAP machine. That's fine. We do that too. That's what we do. Once we reach a certain number on the CPAP machine and you need a more pressure, we would go to BiPAP, which is a high pressure in and a lower pressure when you breathe out. So with the BiPAP, it works just like the CPAP. It's the same thing. It's just higher pressures. One thing that you would need to do that we don't provide as far as CPAP is going to be a DME company, this durable medical equipment company. I tell patients these are the companies that provide wheelchairs, walkers, hospital beds, things like that. They also provide CPAP equipment. So when you do have your study done, we're going to say, what DME company do you want to use? And we send your orders to them. It's just like a prescription, like you would get for medication. And once we send your orders to them, they start that care for you. They take care of you as far as your CPAP machine, your mask, your hose, all of the supplies that you need. So that's a little bit about CPAP and what that is. I'm sure there's some questions about that. If I didn't cover everything, I'll be glad to answer. The last thing I want to talk to you about is the long-term care with CPAP and how weight loss affects that in different ways. Based on my experience with patients that have had bariatric surgery, is pretty good. I like to see that the patient comes off of CPAP. That's your goal. And who wants to wear a CPAP the rest of their life? If weight is the factor, then great. If weight is lost, then maybe you can come off that CPAP. Some patients typically like to just take themselves off the CPAP to see how that works. I don't recommend it, and I don't think that your doctor would recommend it either. It's definitely something that you would need to talk to your doctor about before you take yourself off of the CPAP. But we can always just do another sleep study and see if you still have sleep apnea. And if you do, so let's say you had a sleep study and you lost quite a bit of weight, but you think you still need that CPAP. Well, if you was titrated to a pressure of 14 or 15, at this point, because you've lost weight, you may only need a pressure of 6 or a pressure of 5. So that's something that we can do for you. We can actually do another study to figure out what pressure you need. For some patients, CPAP is just their way of life. It's just how it is, and that's what you wear. But I like to say that CPAP is a foolproof treatment. I wish it was a cure, but it's not. It's a treatment. To me, if I take Tylenol for a headache, I hope that headache goes away. I'm not really sure. But when you use a CPAP, back to my picture here, you are opening up that airway and you are breathing like you're supposed to at night and getting that rest that you need. Is it hard? Yeah, it probably is hard, and it's very annoying, and who wants to put that on every night? But it is worth it. Absolutely worth it. I know that I've talked really fast today. I was a little nervous here. If there are any questions, that would be great. I'd be glad to answer any. But that's all I have for you guys tonight. Thank you, Vivian, for having me.
Hello, I hope everyone can see me. I just want to thank you again, Stevie, for doing this tonight. And if you have questions, you can type them in the box and I will repeat them so that way Stevie will know exactly what question you have. So I'll give you about 5 minutes if you need to type in a question. All right, Stevie, someone would like to know, does everyone who snores need a CPAP?
No. Typically, yes. The answer is going to be yes. But I have had patients that just snore. It's just the way that your airway makes a sound when you are asleep. However, usually snoring is a result of you not breathing. So remember when I told you that when you stop breathing in your sleep, it sends a signal to your brain? Well, that signal is going to make you do anything you can to get that breath back. So when you stop breathing, you may jerk your leg, you may make a really odd sound, which is a snore, or you may kind of jump a little bit. That's just a reaction of your body when you've stopped breathing. So typically snoring is associated with sleep apnea.
Okay. Any more questions? All right. I do
Hey,
not.
I seen something.
Did you see another one?
Oh, it was just more of a comment, so that's great.
Okay. Well, all right then. Well, I really appreciate you doing this, Stevie, and I really appreciate everyone that joined us tonight. We'll be back next month, the first Thursday of the month, and have a good night.
All right, thank you so much. Bye bye.
Bye bye.